Hi, everyone. Thank you so much, Marisa, for such a kind introduction. Well, thanks everyone for being here. This is very last session for the Catalyze meeting. So thanks you for staying with us. And I'm truly honored to acknowledge and celebrate the remarkable researchers and scientists who at this early stage of their careers have made exceptional contribution to the technologies funded by Catalyze. It has been nothing short of inspiration to witness the incredible diversity of talent and unique career journeys that have brought them to this program. And selecting the finalists for this year Catalyze Early Career Award, which is the only second time that we're doing it, but we've been very excited doing that, was actually a very challenging task for me as well for 6 members of the review committee. So today we have a privilege to recognize not just one, but 3 outstanding individuals who have demonstrated exceptional promise and dedication. So first, I would like to introduce Safiya, Aafreen, and Matthew, Rudy, who are 2 distinguished runner-ups. Safiya and Matthew, your contribution to the Catalyze program have been nothing short for outstanding. You've been shown innovation at your work, and we're thrilled to present you with a Catalyze power device and Yeti mug as a token for our appreciation. So we appreciate a few words from Matthew and followed by Safiya.
Okay. Thank you. I can start first. First, thank you for the introduction. I'm very grateful for being recognized for my work, and it would not be possible without the help of my team and my PI, Dr. Aaron Fleischman. Some background on the work we're doing. Over the last several decades, interventional cardiologists have refined their craft and advanced their capabilities in part due to imaging modalities, IVUS and OCT. Each of these imaging tools must be carefully picked due to their specific advantages. Our lab is developing an imaging modality, IVUS, that aims to be the best of both worlds with high resolution and penetration. As a resident engineer, I was responsible for translating ideas. This includes modeling ideas into CAD, but also communicating the idea among collaborators. My approach to designing, building, and working with others has greatly improved due to my lessons learned on this project. I'm implementing these lessons in other areas, including volunteer work in a structured innovation challenge that I'm facilitating in our institute, and a fellowship program that I'm also part of. If I was to summarize what I've learned is to be resilient to failure. Rome was not built in a day, neither were MRIs, IVUS catheters, and I'm sure not your grants. Do not be afraid of failure, embrace it, learn from it, and keep innovating. Thank you again. I'm very grateful for the committee's recognition. Thank you.
Thank you, Matthew. Safiya, can you please say a few words?
Definitely. Can everyone hear me? That's great. So again, thank you, Catalyze, for awarding me the runners-up position in this competition, and of course, for your unwavering support and recognition of our project. I'm a second-year PhD graduate student in Dr. Gonchili's lab at Johns Hopkins, where our primary objective is to harness MPI MRI bimodal imaging techniques for the non-invasive tracking of extracellular vesicles targeted towards infarcted myocardium. In this project, our central role involved isolating iPSC EVs, fine-tuning the particle size for imaging nanoparticles, which are used in the imaging modalities. And this was to achieve optimal EV labeling and also the in vivo detection of our theranostic particles for the disease. We have successfully accomplished this aspect of our research with the help of Catalyze. And as a runner-up in this competition, I am both honored and humbled. This recognition is not just a reflection of my efforts, but it's also a testament to the unwavering support of my lab members, mentors, and of course, the Catalyze team. Witnessing the potential impact of our theranostic EVs has inspired me with a sense of purpose throughout this journey. I'm motivated to explore entrepreneurship and commercialization opportunities to ensure that our research reaches patients who can benefit from it the most. Thank you all for this opportunity.
Thank you so much, Safiya. Well, it's kind of strange. I've never seen a award ceremony virtual environment, but maybe we can applaud to our runner-ups. And I'm very happy to introduce our winner, Alexandre Caprio, who will receive the main prize, Apple iPad. So Alexandre has not only excelled in his research, but has also demonstrated an exceptional ability to communicate and share his insights. Without further ado, Alexandre, I'll pass on to you to present your work and finish the first day of the Catalyze meeting. Thank you.
Thank you very much. Thank you. Let me just, can you all hear me well?
Yes.
Yeah, I'm just waiting on checking. Start sharing my screen. Thank you. Sharing. So thank you everyone, and thank you so much for giving me the opportunity to present my research one more time. My name is Alexandre Caprio. I'm from France, where I earned my master's degree in biomedical engineering. And since then, I've been working at the Weill Cornell Medicine, specifically at the Dallo Institute of Cardiovascular Imaging. It's a genuine privilege for me to show you all the progress we did on this Catalyze project. I've been involved in the very beginning and the early stage to the now most sophisticated device that I'll be sharing with you. So to start, did you know that over 33 million people are affected by a heart condition called atrial fibrillation? Atrial fibrillation, or more commonly known as AFib, is characterized by a irregular or rapid heartbeat. This can lead such symptoms such as palpitation, fatigue, or breathlessness. And in addition to the day-to-day discomfort, patients with AFib live in a constant fear of having a stroke. I think that's enough to say that better treatment and something efficient is urgent. The current method of treating AFib involves mapping the inside of the heart, mapping the electrical signal to identify and isolate the problematic areas. It does exist some devices that can do that, but they often fall flat. Usually they are very slow and time consuming. They require tedious point-by-point mapping, or sometimes due to their rigid structure, they struggle to conform to the heart's unique and complex anatomy. Now, with our soft robotic mapping catheter device, we are addressing those challenges heads-on. Our device is an ultra-thin polyurethane balloon embedded with 64 electrodes. It means that it's highly flexible and it conforms perfectly to the heart's intricate walls. Plus, this design allowed to have the more electrode to make contact with the heart surface, which means a quicker and more accurate collection of the electrode signal. I think this device can revolutionize the treatment of AFib because it will make all the procedure go faster, easier, and way more efficient. All those benefits will also translate for the patient. They will spend less time under anesthesia, so less risk and a faster path to recovery. Regarding the doctors, also have benefits. They will have greater outcomes, they'll be more efficient, and they'll have the potential to maybe save more lives. Let's now talk a little bit more my contribution and why I did that project. My role was multifaceted and pivotal for this project. I oversaw the conception of the entire soft robotic balloon. So one of the first challenges that we had was to optimize the balloon itself. We started off with a 2D laser-coated cage-like balloon, but I led the transition to something more efficient. We are now using a heat pressing method that allows us to have reproducible watertight seams, which allow us to go to way higher pressure and also avoid any type of leakage. One of the other challenging part for me was to find the perfect combination of size, dimension, and to be able to have the best balloon. But I think now we get all the best element and we have the best actuation possible for our devices. Another step in the evolution of a balloon was the introduction of a rod on which the balloon was mounted on. This allows us to add a third dimension to our device. That allows us to have manual shape changes and rotation. That way we're enhancing our device flexibility and how we can access challenging areas inside of the heart. Another part of my responsibility was the integration of flexible electrodes. To do that, by strategically layering and bounding a different sequence of film, I was able to maintain the flexibility of our entire device, and also to guarantee electrical isolation. So as you can see on the picture, only the pad will be exposed and not the circuit. So we will have no short circuit or anything. Finally, we conducted comprehensive testing. Using our lab technology, we were able to 3D print a realistic human heart model. There's supposed to be, okay. And don't know why it's lagging. And those those models serve as foundation for testing our balloon conformability into patient-specific atrium. And as you can see, we're making sure that every electrode is in contact with the balloon itself. In which electrode in the balloon was in contact with the heart wall. So I think that with all of the effort, we are getting closer and closer to better treatment for AFib. And thanks to positive feedback from clinician, and successful animal testing, I think that we are on the right track. To talk a little bit more about everything I learned during this project, during this Catalyze project, I had to venture out of my comfort zone and especially discover new ways of fabrication and new methods of fabrication, especially in soft robotic. And I'm proud to say that all the skill I gained during this heat pressing method are very valuable. As you can see now, we are using it on a different project, which means they are highly versatile and they have a big impact. I'm finally starting also to learn about regulation, and that's where Catalyze helped us a lot, because they are playing a crucial step in bridging the gap between our academic research and our future commercialization. They give us so much insight and knowledge about regulation. They tell us about creating a history file that now has proven to be indispensable. We're using it for every conversation, every meeting, or every discussion. I really think that Catalyst really help us accelerate our research, because they really structure us with constant feedback and guidance that really helped us keep our project on track. Thanks to them, it was very easy for us to start working on animals and having animal studies, which was very important and crucial, because we were both able to validate our device and to refine it. So yeah, and Catalyst also being there and trusting our project was a great boost for our motivation and confidence into finding a better way to improve life for people living with AFib. To conclude, I will just say that looking back on this 5 years journey with our soft robotic mapping catheter, I'm most excited to know what's going to happen next, because our whiteboard prototype is no longer here. Now we have a real devices that is making his entrance into the real world, and hopefully soon enough, it will be able to have a positive impact on people's life. Yeah, thank you very much for your attention.